Guys, this is Dr. Shumard with Integrative Wellness Center of San Diego. And today, what I want to discuss is the 3 questions you should be asking about your thyroid condition. So, if you've been currently diagnosed with a thyroid condition and you have not asked these 3 questions to yourself or to your doctor, these 3 questions are going to be very important for you to understand. And I'll go through each one of these and why they're important for you to ask as well. And one thing is, as we're going through this presentation here or this little video, if this video is great information for you, I just ask that you share it and like it. It really helps us out to disseminate that information to as many people as possible. One of the things that we pride ourselves here in this office is not only about the education that we give, but the quality of care as well. We've just had another patient recently starting to feel so much better, who's been dealing with his thyroid problems for many, many years, been getting off medication. She was able to get off her cholesterol medication, her blood pressure medication. And these are just those few things that we've seen from close to thousands of patients that we've helped in our practice with thyroid conditions. So hopefully this information will help you out as well if you're dealing with a thyroid condition or maybe some other health-related problems, and maybe this can help you move over that hump to getting yourself healthy again. So let's go over those 3 questions. So again, we have the 3 questions. The first question you should be asking yourself or your primary care doctor is, have you been tested thoroughly? Thyroid. So what that means is, has your thyroid been analyzed thoroughly? Most of you, when you're getting your thyroid tested, your doctor's going to analyze TSH, maybe T4. But have they ran all the markers? So imagine this. Imagine you go in to see your doctor, your TSH is normal. Your doctor's saying everything looks normal, but you still don't feel good. You still have symptoms, you still have problems. Maybe you have your hair loss, fatigue, weight gain. You don't know what's going on. You can't lose weight no matter what you do. You've done 800 calorie diets. You're exercising twice a day and nothing's coming off. It's still not better. If you're having these symptoms, it's likely because you haven't been thoroughly analyzed in regards to the thyroid. There are 10 markers that should be analyzed. These are important because if your TSH is normal, isn't it possible that something else could be going on? And if you don't look at all the markers that are involved with the thyroid, you're going to miss that. But many times your doctors just won't run that, so you have to make sure they will run it, or you have to find someone like myself who can run these tests and disseminate that information to give you the best outcome. So those markers, and I'm just going to say them really quickly, and I can always put them in the comments if you want me to. TSH, T4, free T4, T3, free T3, free thyroxine index, T3 uptake, reverse T3, thyroid peroxidase, and thyroglobulin antibody. Those are the 10 markers that should be analyzed. If you're still experiencing thyroid symptoms and your doctor's saying your thyroid is normal, you need to have those other markers analyzed because there could be something else going on. So that's number 1. Have you had your thyroid thoroughly analyzed appropriately? Number 2 is comprehensive diagnosis. So what does that mean? Well, let's just say you had all those thyroid markers analyzed, and at this time everything was good on your thyroid, but you're still experiencing symptoms. So that means there must be something else going on inside the body. There are other conditions, diseases, systems, tissues in the body that could be malfunctioning right now, and it can mimic thyroid symptoms. So one of the common ones that I always talk about is the adrenal gland. Many people have heard of the adrenal gland. It sits on top of your kidneys, also referred to as your stress gland. So when your body is under stress, your adrenal gland is going to respond by releasing a hormone called cortisol. Well, what is the common thing we know with cortisol? It can cause weight gain, but it can also cause fatigue, sleep issues, brain problems, brain fatigue, mental fatigue, short-term memory loss, a lot of things that are associated very similar to thyroid conditions. So you could have an adrenal issue thinking it's actually your thyroid, but nobody's analyzing. That's one example of another condition that could be going on. There could be hundreds of other ones, which is why it's so important that you have a comprehensive diagnosis, which requires a comprehensive analysis. So we not only need a comprehensive analysis for your thyroid, meaning look at all the markers, but if that looks good, then we have to look at the entire body. What is the physiology showing us? Where are things breaking down? You know, you take your car to a mechanic, you have them hook it up to a diagnostic machine because you want to know what the problem is. They give you a printout. Here's all the problems that are going on with your car, and you want to get a solution. Why does that not happen in our traditional medical model? Because again, the treatment of choice is to treat you with drugs, pharmaceuticals, not to find a solution to create a solution to fix the problem. So once we do a comprehensive analysis, getting the comprehensive diagnosis, we can give a customized protocol for the individual to get better. So we have our first one, which is getting a full analysis of the thyroid, looking at all the thyroid markers that are involved with thyroid function. The next level would be to analyze, is there somewhere else in the body, some other system, some other tissue that's not working properly that is contributing to thyroid-like symptoms? That has to be analyzed and diagnosed. And then a customized protocol can be put together. The third one, which is very important, do you have autoimmune disease? Now, some of you may know what this means, some of you may not, but the most common cause for a thyroid condition in the United States is autoimmune disease called Hashimoto's thyroiditis. What that means is that the immune system is attacking, destroying, and killing the thyroid. Over time, as that continues to destroy the thyroid, eventually the thyroid becomes sick, if you will, and is no longer able to produce enough thyroid hormone, giving that individual the signs and symptoms of a hypothyroid scenario. Now, this has been diagnosed in a medical model. The person is given the right pharmaceutical drug, which is a thyroid hormone replacement. That may be levothyroxine, Synthroid, or maybe some other bioidenticals like Natrithroid, Armour, something like that. The person's given those medications, stabilizing the numbers on the thyroid, but it doesn't have any impact on the immune system. The immune system continues to attack the thyroid and can likely start attacking other tissues as well in the body, creating new diseases, new autoimmune diseases, and new problems and their symptoms. So because the treatment is not addressing the autoimmune, the person gets sicker with time. They continue to get worse with time and eventually need more and more medication of the thyroid medication and also additional medications because the body's breaking down. So if someone has autoimmune disease, that has to be addressed. And there are specific things that can be done in the model that we do here, which is referred to as functional medicine, to help that person heal, to stop the immune system from essentially attacking the body in multiple different areas, as well as the thyroid, by putting the right types of protocols and steps together, the lifestyle changes to help that individual heal and to live that better quality of life and to reduce their symptoms. So again, these are 3 questions you should be asking yourself and potentially your doctor of why you still have these symptoms that are going on inside your body. Have they done a full analysis on your thyroid? Have they looked at every single marker? Have they done, if all those markers are normal, then have they done a full comprehensive analysis of your entire body? Looking at all the physiology, all the tissues, all the systems, everywhere to make sure everything is working in tip top. And then also one other one is, have you been analyzed or diagnosed or had a test ran, because there's tests that can be ran for the autoimmune disease, for Hashimoto's. These things are very important to really understand what is it that's going on in your body and what are the right steps. See, there is no one-size-fits-all approach for thyroid conditions. We have to understand what is causing your problem, your symptoms, to put the right approach into place, to put the right protocols in place that is customized to your needs. Once that happens, you get better. Just like the patient I talked about earlier, who's now able to get off multiple medications because the body is now functioning better. She no longer needs the medications. Her body is working more efficiently. She has better quality of life. She's going to sustain that for the rest of her life as well through the lifestyle changes that we're going to educate her and teach her to live that quality of life, to spend time with their family, spend time with their spouse, enjoy the retirement, whatever it is that you're trying to do in life. So here's the deal. If for some reason your doctor will not run these tests, which in many cases they don't, well, you can always call a doctor like myself, a functional medicine doctor, who can run these tests for you, who can thoroughly analyze you. If you have concerns and you're not getting the results you want in the clinical model you're doing, maybe you need to look into a functional medicine doctor like myself. So you can always give our office a call. I'll put our contact information in the comments. And we can schedule a consultation to see if something like what we do here is appropriate for your needs. Is this model the best option for you? Or maybe it's another doctor who does functional medicine as well. It really is all about you getting better, you getting the quality of care you need, and getting the results that you deserve. Okay. So here's the thing. If this information was viable for you, it's really about me trying to provide as much value as possible to help you live a better quality of life. My goal, my passion is to change the face of healthcare, to change the face from a drug therapy approach to a holistic and healing approach. Our bodies have the ability to heal, but we start to lose that ability when we create an environment that healing can no longer take place. If we can recreate that environment of healing again, we can heal for the rest of our life and live a quality of life and be confident that we can fight off these crazy infections or whatever else is going on in our society and live that quality of life for ourselves and for our family. So if this information is valuable for you, please like this video, share it to your friends and family, share it on your social media outlets. It would really help us out, and more importantly, it'll help out the community and your people that are involved in your life, because maybe someone right now who needs this video is never going to get it unless you share that. So please share that. That would really be beneficial for someone else, as well as help us disseminate this information. So again, I hope this information was valuable for you today. Enjoy the rest of your day. And if there's anything you want me to talk about in the future, if there's a condition, a problem you're dealing with, or if you had additional questions based upon what we talked about today in this video, please comment below. I'll be more than happy to put together a video or answer those questions for you one-on-one. I will put our contact information in the comments, so if you want to give our office a call, we can set you up for an initial consultation that can be done either virtually or we can do it in office, whatever you feel comfortable with. Enjoy the rest of your day. I look forward to seeing you or meeting you or talking to you in the future through comments on social media or maybe in person or virtually. Have a great day, you guys. Take care.